Today I have something very important for all of you that's not being reported by the mainstream media. If you don't know, the UK Parliament recently had a debate over the safety and efficacy of COVID-19 vaccines. If you're not aware, Parliament is the UK's supreme governing legislative body. That said, I'll now present to you some clips from Parliament's COVID vaccine debate that recently took place, and you'll quickly see why most media stations haven't reported on this. I'll also add, I won't be putting my spin on this because I want you to come to your own conclusion. Roll the clip.
And my query starts with this simple point. In October 2020, when the vaccine was getting ready for rollout, Kate Bingham, the head of the Vaccines Agency, said this: there's going to be no vaccination of people under 18. It's an adult-only vaccine for people over 50, focusing on health workers and care home workers and the vulnerable. Now, why was it extended to the whole population? I don't think we've ever had a completely satisfactory answer to that question. And I raise it because my concern is that in extending the vaccination programme, it became an operation in public persuasion, an operation in which dissent is unhelpful or even immoral, justifying suppression, even vilification of those who raised concerns. Happy to give way.
I thank my honourable friend for giving way. Would he also question, unlike any other vaccine, the vaccine was actually given to people who'd got natural immunity because they'd actually contracted and provably contracted the virus, and so they would have had natural immunity. Why were those people vaccinated?
My honourable friend is absolutely right. The best vaccine against COVID is COVID, and many people were indeed naturally immune, and I think there are questions to be asked about the effects of vaccination on the immune system. So now I do understand why. My honourable friend, the member for Cotswold and Wallingford, made a very understandable point about the importance of resisting misinformation, and certainly there, as I mentioned, many crazy theories out there which we need to not give credence to. If we're talking about a programme of vaccinating the population, it is important that the public is persuaded to do what the government wants them to do, and I understand why the government should have a public health information campaign along those lines. But it is an essential principle of medical ethics that people need to be able to give their informed consent before any treatment. And I do worry about how we can say that consent was fully informed in all cases. Throughout there has been, I wouldn't say deliberate, but there has been some misinformation, possibly accidental, in favour of the vaccine. We can tell this with hindsight. Perhaps the most egregious, and the doctor that my honourable friend mentioned earlier presented on this to the APPG last week, Dr. Malhotra, the claim that the vaccine is 95% effective. And what that means is simply the relative risk, not the actual absolute risk, reduction in risk to an individual. The absolute risk reduction is really less than 1%. There was the widespread claim that the vaccine stops transmission, so people should take the jab to protect other people. We were all told that. We all believed that for many months. Last month we heard from Pfizer that their vaccine was never tested to see whether it would stop transmission. And yet we had the notorious claim by Professor Chris Whitty that even though the vaccine brought no benefit to children, children should be vaccinated to protect wider society. Now, I'm all for thinking about society, not the individual, Sir Roger, but that, again, it feels to me a profound break with medical ethics. And a lot of people are asking what the vaccine does to children and young people. And Dr. Whitty is right that the benefit to healthy children seems to be essentially nil. And yet there are genuine questions to be asked, and I do not verify these questions, I merely ask them on behalf of my constituents. How do we explain the increase in the rates of myocarditis, the increase in heart attacks and the excess deaths among young people? And indeed in the general population, it is plausible, not definitive, but plausible, that the vaccine is responsible for more harms than we know about. And I mentioned in my intervention earlier that we know from the yellow card scheme that up to 1 in 200 people vaccinated report an adverse reaction, and that is in itself bad enough. But we also know that yellow card reports, the adverse effects are significantly underreported through the yellow card scheme. Based on the MHRA's own research, there may be as many as 10 times more serious adverse reactions, serious ones, not just any ones. There may be 10 times more serious adverse reactions than the yellow card system shows.
Okay, so this next clip involves another Speaker of Parliament. His name is Mr. Burchin. He also brings up some very interesting points about public health and COVID vaccine safety. Have a listen with an open mind. Roll the clip.
Mr. Burchin. Thank you, Sir Roger. It's a pleasure to serve on your chairmanship. I'll try and curtail my remarks to 6 minutes. However, this is a hugely important debate, overdue, and what we do know is that those people who've questioned the efficacy or safety of the vaccines have generally been cut down, cancelled, and that's why this is so important. I don't claim to be any sort of expert, but my degree a long time ago was in genetics, behaviour and biochemistry, and science works by challenge, and what we do know is that the science behind these vaccines has not been allowed to challenge. A study in the Journal of American Medical Associations published included 7,806 children aged 5 or younger who were followed for an average of 91.4 days after their first Pfizer vaccination. The study shows that 1 in 500 children under 5 years of age who received a Pfizer mRNA messenger ribonucleic acid COVID vaccine were hospitalised with a vaccine injury, and 1 in 200 had symptoms ongoing for weeks or months afterwards. This is what the studies found. Would the Minister, in response, outline what the government's current policy on vaccination and boosters is, and also outline what our current policy for the vaccination of children is? So 0.5% of the children, so 40 out of the 7,806, had symptoms that were still ongoing, so that it was of unknown significance at the end of the trial. That was a 2 to 4 month follow-up period. So 0.5% of the children had an adverse effect that lasted for weeks or months. 2 cases, the symptoms were confirmed to have lasted longer than 90 days. Given this evidence, perhaps the Minister can explain to us why we're vaccinating healthy children who are at minimal risk from COVID. And surely this is in breach of the Hippocratic Oath, to do no harm. We're not in a situation where we can ask young people to risk their lives to protect older people. That's, in a civilised society, that can't be the way it works, Sir Roger, at all. According to The Independent, in April this year, more than 1,200 claims have been made to the Vaccine Damages Payment Scheme, which entitles successful applicants, as my right honourable friend, the member for Christchurch, pointed out, for £120,000 if a causal link between vaccination and severe reaction culminating in injury or death is proven. Does the Minister recognise these figures? Sarah Moore, a lawyer who represents 95 families seeking claims, said her clients felt silenced and ignored, adding that they cannot speak about vaccine harm or linked injuries without being accused of being anti-vax. What's the Minister's view on victims being labelled as anti-vaxxers? The Department of Health and Social Care commissioned research through the National Institute of Health Research. 1.6 million has been allocated for a programme to understand the rare condition of blood clotting with low platelets following vaccination for COVID-19. Does the Minister think this is sufficient, and is there sufficient breadth of investigation considering all the things we're finding out about these vaccines? Where's the cost-benefit analysis by age group for the vaccines, given the risks that they carry, especially as the pharma companies are now admitting that the vaccination does not impact on transmission? And did the government, at the time of the mandating vaccines for care workers and NHS workers, know that the vaccines had not been tested to whether they actually prevented transmission at the time the mandates were brought in? The Florida Department of Health, Sir Roger, conducted an analysis through self-controlled case series, which is a technique originally developed to evaluate vaccine safety. This analysis found that there is an 84% increase in the relative incidence of cardiac-related death amongst males 18 to 39 within 28 days following a messenger ribonucleic acid vaccination. And with a high level of global immunity to COVID-19, the benefit of vaccination is likely outweighed by this abnormally high risk of cardiac-related death amongst men in this age group. The recommendation now in Florida is that they do not have vaccination of any male under the age of 40. Studying the safety and efficacy of any medications, including vaccines, is an important component of public health. That's the Surgeon General, Dr. Joseph Ladapo, Far less attention has been paid to safety, and the concerns of many individuals have been dismissed. And these are important findings that should be communicated to all Floridians. I would suggest, Sir Roger, these are important findings that should be transmitted to everyone who's had a vaccine or is contemplating having a booster. I also had the pleasure of meeting Dr. Azim Malhotra last week at the APPG launch, and he made a very, very strong case that up to 90% of adverse vaccine reactions are actually not even being reported. And finally, I wish I had longer to speak. Finally, the excess deaths we're suffering at the moment in this country, across Europe and in the Americas. What analysis is the government making of these excess deaths? But even a casual glance at the data shows that there's a very strong correlation between vaccine uptake and the level of excess deaths being found in that country. Surely we must have an investigation. These are tens of thousands of people who are dying more than we're expected. It's really, really important. And I think if we don't get this right, no one's going to believe we're going to lose trust in politicians, and we're going to lose trust in our medicine and our medical system. Thank you very much.
So, considering everything you've just seen and heard, it's quite obvious why this footage of Parliament's COVID vaccine debate hasn't been reported by the mainstream media. It seems to me, anyway, these members are advocating for better safety and efficacy data and broader protection for those injured by this medical intervention. It also seems they imply it's difficult for individuals to freely consent to a medical intervention if all safety data isn't known or available. It seems to me those claims are reasonable. Then the question becomes, why have a debate about protecting people? Why not just do it? Let me know what you think in the comment section below. Anyways, those are the facts, and I'll see you on the next one.